ourselves real quick, and then I'll be talking for a few minutes, and then Amy will come on and talk probably longer. So I'm Beth Howell. I'm an addiction psychiatrist at the University of Utah, and run the addiction medicine, addiction psychiatry fellowships there, and have been doing some work in East and Southeast Utah for several years. So I know a lot of people here, and which is great to see everybody. And we're going to talk about complementary treatments, and we're going to focus on a couple that I'll talk about in a minute.
And I'm Amy de la Garza. I'm a family practice doctor. I actually trained at St. Mark's with Dr. Pat Green, who has also been a mentor of mine for a long time, so it's fun to be here with him. I'm addiction medicine fellowship trained by this lady, and I've been kind of out and about in the community working in different places, but I've come back to my true north, which is my private practice. I have a private practice downtown Salt Lake where I focus on integrative behavioral health and substance use disorder. And I'll be talking a little bit about what that means. So thank you for having us.
So we're doing this a little bit out of order just because some of you probably know that we're going to be offering ear Acudetox, and so we wanted to go ahead and get that started because with this many people, it takes a while to put the needles in. So that's the first thing that I'm going to actually talk about. We don't have anything to disclose. Amy will be talking a little bit about some off-label use of nutraceuticals. Ooh, I'm not sure what happened there, but anyway, these are our objectives. So normally we put the 5-needle protocol at the end, but we're going to talk about it at the beginning so that people can get started on the treatment. After that, we'll talk about key components of integrative behavioral health and introduce the importance of nutrition in behavioral health and SUD treatment, and identify some evidence-based nutritional supplementation. And there's a lot of other topics we could talk about, but we don't have all day. So let's talk about 5-needle protocol. On your table, if you're interested in having this, there should be some alcohol swabs. And the first thing you do is you open it up and you clean the outside of your ears like this. So not the outside, but the inside outside. You don't have to stick it down the ear canal or anything like that. This is, who's had this before? Raise your hand. Okay, so yeah, anybody who has questions, you can ask these other folks. There's some in here that are real pros that have had it a bunch. But, so clean out your ears, and there are several people, Jeannie and Alanis and Bobby and Marcy. I don't know if Alanis is here yet, but hold up oh, there she is. Okay, great. They all have these white pieces of paper, and they're going to be going around, and if you're interested in getting this, just go ahead and raise your hand, and then they'll come around and give them a little time. But if you see one of them, they'll be able to come in and help you get some ear acupuncture. So while we're starting that, and you'll see why in a minute that we want to go ahead and get you all started. It's not just something you get, and it's not 2 minutes long. It's it's something that you want to spend some time with. So yeah, just raise your hand. You don't have to say anything or yell, and they'll be going around. So just wait till they get closer to you, and they should come over and help. So if you see them. And then I'll be coming down when Amy's talking, and I'll be doing it too. So what is this protocol? Has anybody heard it? Those of you who haven't had it, have you heard of it before? Okay. It was developed about 30, 40 years ago probably, and originally it came about in the Bronx in New York, where people were not necessarily that excited about methadone. Now, methadone at that point was kind of seen as kind of enslaving people into this, really intense sort of lifestyle. Now, we all know, yes, it's very restrictive, but it also is very life-saving. It was a very different kind of viewpoint at that time. But it was developed to help with the detoxification from opioids and cocaine and other drugs. And so what is it? It's not pharmacological. There's no medicine in these needles. There's nothing that you have to talk about while you're doing the treatment. It's a complementary approach, and it's really helpful for people who have substance use disorder and have experienced stress or trauma okay? And up until about a year and a half ago, the only people in Utah who could do this were physicians, MDs or DOs, acupuncturists, and chiropractors and naturopaths. And so in 2022, we launched a real concerted effort to change the law, because you will see that it's intensive to do this, and time intensive. And so we needed more people to be able to do it. So we passed, we didn't pass it, but the legislature passed House Bill 195 with the help of Dr. Suzanne Harrison. And now, yay! Yeah, first try too, yeah. So now, PAs, nurse practitioners, nurses, social workers, mental health workers, CMHCs, SUDCs, ASUDCs, there's a whole long list of people, not physical therapists and not massage therapists, but people with a license in the mental health field that have a license in good standing can get this training. So now we have a lot more people who can do it. So what do? We have these 5 small, and they're really tiny. I mean, they're like maybe, not even, no, they're much smaller than getting a flu shot. Needles that are placed in specific sites on the ear, and this is where we put them. Then you sit quietly in a group setting for 30 to 40 minutes, and this isn't going to be quiet because we're going to be talking to you, but you can hopefully feel some of the effects, some of the relaxation. People normally describe feeling warm or tingly or heavy or sleepy or whatever, so if you fall asleep during our talk, that's okay. There's really not a bunch of problems that it can cause. You might get a headache, and if you get a headache, you need to raise your hand, because that tells us that your body doesn't want at least one of those needles today. You can get lightheaded. Some people might faint. That's very unusual, but if you feel faint, let us know. We'll take them out. And if you don't like needles, we don't have to use them. We have beads or seeds that go on the surface of the skin, and they just, on a little piece of tape, they sit on your ear on some of the same points. We can't reach all of them with the beads. So these are the 5 points that we use, and the names of them are Shen Min, sympathetic, kidney, liver, and lung. And you say, well, why did those 5 points get picked? Why were they chosen? Well, think about people who are in early recovery, okay? Restless, irritable, discontent, on edge, anxious, you name it, right? That's the way you feel. So Shen Min is calming, it reduces cravings, and it helps with anxiety and insomnia. At least this is the theory, and Chinese medicine has very different theories than Western medicine. So sympathetic point calms the nervous system. So, the thing I just described is you're on overdrive with your sympathetic nervous system. This point, when it's needled, will calm that process down. And it turns off that fight or flight kind of reaction. The kidney point strengthens will and reduces fear. The liver gives direction in life, and it actually helps with anger and depression. And lung provides inspiration and helps with grief. So grief, anger, anxiety, fight or flight, doesn't that usually describe early recovery? Yeah. So these needle points are not supposed to make that worse, they're supposed to help and balance. So we use these very thin, and sometimes we call them pins, because they're not hollow. It's not like an injection from like a syringe. They're hollow. They're not hollow. They're completely solid. We're not putting anything in them. They're single use. We really, you shouldn't feel more than like a slight pinch or some discomfort. It's not sterile. We don't have to wear gloves. We don't have to wear masks. We don't have to do all that stuff. But that's why you clean your ears, just to decrease the risk of infection. Everybody has one of these consent forms, so if you're getting the needles, you need to sign this. We keep these on file. We're probably not taking pictures of you, but you can just, sign that. And 3 things you want to ask yourself before you get the needles in. Do you need to go to the bathroom? Go ahead and do that. Have you eaten something so your stomach's not empty? And please turn off your cell phone, because you don't want to answer it against the needles. That doesn't feel good. And also you want to relax, okay? And I don't think people relax very much with their cell phones. And then you want to sit for 20 to 45 minutes. It really is up to you. If you say 5 minutes and I'm done, that's okay, we'll take them out. It's up to you. It's completely up to you if you get them, how long you leave them in, etc. The main side effect is relaxation. Woohoo! Okay. And the downside is you might, like I said, have a headache. You might get a little bleeding. Sometimes we push the needle all the way through the ear, but that's not really a problem. Your ear is not very thick, so sometimes it's hard to get it in enough to stick there without going all the way through. We always want to make sure we're not sticking ourselves, so we handle the needles with care. Don't take them out yourself. Ask for one of us to take them out. If one falls out, just pick it up off your clothes and put it on the table, and we'll get it and put it in our sharps container. And one thing just to know is that I'd say, in what we've seen, about 1 in 25 people or so will feel worse. And we don't know why, we don't know who that's going to be. But if you don't feel good with it, that's fine. It's just today may not be your day, or maybe it's not your day ever with the needles, and we'll just take them out. So don't feel, concerned if you don't feel better. You might get immediate benefit. We don't really tell you what you're going to feel, because everyone is different. Every single person in this room will have a different reaction and experience. But as long as you can get this treatment frequently, like maybe a couple, 3 times a week, and then go down in frequency, it can really help. And then there's some evidence, and there's references at the end of our presentation. So you need to remember, sign the consent form, stay in your seat. We don't want you walking around while you have needles in your ear. But if you need to go to the bathroom or you're ready for them to come out, let us know. And if one falls out, then just put it on the table and we'll pick it up for you. Any questions? Because I think that's all I'm going to say before Amy starts. I know everybody has hands up, but that's for getting the needles, right? Yeah. Is it an evidence-based program? So there is some evidence that it does help. Amy, I think we'll talk some about this. Actually, let me go back to this slide. So these are some of the papers that show some benefits. People who get the 5-needle protocol, and once again, we're not acupuncturists, because if you've been to an acupuncturist, you know you do more than just your ear. So we're not pretending to be acupuncturists. It can improve the quality of your life. reduce mental and physical symptoms, etc. And these studies all kind of measured these things objectively. Improves treatment retention. You know, I think it'd be great if we started studying it more here. And Amy will hopefully talk about some work that she did at Odyssey House. Improves treatment outcomes. It's a good adjunctive use, has good use in cocaine use disorder, and it can be effective in harm reduction. So you don't even have to be like abstinent to benefit from this. Yeah. So that's some of the evidence. And once again, remember these are all adjunctive treatments. We're not saying, they're not hollow. It's not like an injection from like a syringe. They're hollow. They're not hollow. They're completely solid. We're not putting anything in them. They're single use. We really, you shouldn't feel more than like a slight pinch or some discomfort. It's not sterile. We don't have to wear gloves. We don't have to wear masks. We don't have to do all that stuff. But that's why you clean your ears, just to decrease the risk of infection. Everybody has one of these consent forms, so if you're getting the needles, you need to sign this. We keep these on file. We're probably not taking pictures of you, but you can just, sign that. And 3 things you want to ask yourself before you get the needles in. Do you need to go to the bathroom? Go ahead and do that. Have you eaten something so your stomach's not empty? And please turn off your cell phone because you don't want to answer it against the needles. That doesn't feel good. And also you want to relax, okay? And I don't think people relax very much with their cell phones. And then you want to sit for 20 to 45 minutes. It really is up to you. If you say 5 minutes and I'm done, that's okay, we'll take them out. It's up to you. It's completely up to you if you get them, how long you leave them in, etc. The main side effect is relaxation. Woohoo! Okay. And the downside is you might, like I said, have a headache. You might get a little bleeding. Sometimes we push the needle all the way through the ear, but that's not really a problem. Your ear is not very thick, so sometimes it's hard to get it in enough to stick there without going all the way through. We always want to make sure we're not sticking ourselves, so we handle the needles with care. Don't take them out yourself. Ask for one of us to take them out. If one falls out, just pick it up off your clothes and put it on the table, and we'll get it and put it in our sharps container. And one thing just to know is that I'd say, in what we've seen, about 1 in 25 people or so will feel worse. And we don't know why. We don't know who that's going to be. But if you don't feel good with it, that's fine. It's just today may not be your day, or maybe it's not your day ever with the needles, and we'll just take them out. So don't feel, concerned if you don't feel better. You might get immediate benefit. We don't really tell you what you're going to feel because everyone is different. Every single person in this room will have a different reaction and experience. But as long as you can get this treatment frequently, like maybe a couple, 3 times a week, and then go down in frequency, it can really help. And then there's some evidence, and there's references at the end of our presentation. So you need to remember, sign the consent form, stay in your seat. We don't want you walking around while you have needles in your ear. But if you need to go to the bathroom or you're ready for them to come out, let us know. And if one falls out, then just put it on the table and we'll pick it up for you. Any questions? Because I think that's all I'm going to say before Amy starts. I know everybody has hands up, but that's for getting the needles, right? Yeah. Is it an evidence-based program? So there is some evidence that it does help. Amy, I think we'll talk some about this. Actually, let me go back to this slide. So these are some of the papers that show some benefits. people who get the 5-needle protocol, and once again, we're not acupuncturists, because if you've been to an acupuncturist, you know you do more than just your ear. So we're not pretending to be acupuncturists. It can improve the quality of your life, reduce mental and physical symptoms, etc. And these studies all kind of measured these things objectively. Improves treatment retention. You know, I think it'd be great if we started studying it more here. And Amy will hopefully talk about some work that she did at Odyssey House. Improves treatment outcomes. It's a good adjunctive use, has good use in cocaine use disorder, and it can be effective in harm reduction. So you don't even have to be like abstinent to benefit from this. Yeah. So that's some of the evidence. And once again, remember, these are all adjunctive treatments. We're not saying, oh.
Down Harrison was amazing, and we had great patient advocates who supported us, and acupuncturists, and we got House Bill 195 passed, like you guys heard on the first try. Only 2 people didn't vote in the legislature, and it passed unanimously through the Senate on 2 readings, first try. So that was really, really exciting. And so then we were at the Rural Opioid Wellness Summit in Vernal last year, or the Tribal Opioid Wellness Summit in Vernal, I don't know, 2 years ago? I can't remember. 1 year ago. And Veronica Little and Megan West from the state approached us and said, hey, what do you think about applying for a grant to train in Utah? And we were like, oh, well, that sounds amazing. What does that mean? And so we applied for this grant, and last year we were awarded $100,000 from the state of Utah. So thank you, Megan and Veronica, and the state of Utah. So now we are running trainings, and that's Utah Acudetox. It's not a nonprofit yet, but we're getting there, to run trainings for everybody who has a license, who qualifies. You come to the training, you pay your money up front, and then once you get certified, then I send a check to you to reimburse you for your training. And this is our hope, that we can train as many people as we can in this state, because it is time intensive. It should be delivered 2 to 3 to 4 to 5 times a week, and we have to have lots of boots on the ground in lots of different environments to make that happen for our patients, because it is incredibly rewarding. It is the most rewarding work. I'm so blessed to have done this work in my life. It's absolutely the one thing that makes me the happiest. So I'm really glad you're all getting to experience it. So that's that. So we were asked to talk a little bit about some other complementary therapies and not just talk about how great acupuncture is. So I'm going to talk a little bit about integrative behavioral health and what I think that is. So for me, integrative behavioral health is a patient-centered, coordinated, whole person care that's focused on healing and wellness of body, mind, and spirit. This is not just medicine, it's not just therapy, it's the whole person. And this is how I practice in my practice. It includes allopathic medicine, so all the Western approaches, evidence-based behavioral health interventions that all of you guys provide on a daily basis, and complementary and alternative interventions like what we're doing now, nutritional supplementation, but most importantly, and in my opinion, most importantly, a focus on lifestyle. And lifestyle and functional medicine includes nutrition, sleep, healthy movement, healthy stress management, and repairing healthy social connections. Those are the 5 pillars of lifestyle, integrative, functional medicine that I believe, in my opinion, is grossly absent in all of our treatment. And if people are going to get better, we have to think about ways to incorporate this into our treatment. Okay, so this is my favorite quote. David Wiss is a dietitian, also master's in public health, who has an amazing organization called Nutrition in Recovery, and he's launched this app called Wise 9 Nutrition. And I'm just going to give you a moment to read this and let it simmer for a second. Just please read the quote. Wow, you guys are good listeners. It was like quiet. So anyway, this can be controversial. When I talk about this and do presentations about this work, I get some positive feedback, but a lot of times I get some very negative feedback. Why do we care about what people are eating? We got bigger fish to fry, man. We got to get people off drugs. Why are you worrying about this? Okay? I think this is one of the most important things we can do after we get people stabilized, after they're safely engaged with medications for recovery if they need it. Okay? We consume 1 ton of food per year. That's a lot of food. A giraffe weighs a ton or more. That's why I picked the picture. If we're doing that much of something, my feeling is we should probably be paying attention to what it is that we're doing. How many of you guys pay attention really to what you're eating on a daily basis? Like, how really intentional are you? You know? Like, food is everywhere. We have to eat food. We have to consume it for energy. But it's what we are consuming that I believe and the data would suggest is slowly killing all of us. The top 7 reasons that people die in this country have nothing to do with anything really other than lifestyle. Sedentary lifestyle and poor nutritional intake. 60% of our diet now in developing countries comes from highly packaged processed foods. No nutritional value. No micronutrients. High in fat, high in sugar, high in salt. Somebody asked a question about the gut microbiome. This is the basis of my life work, is the gut microbiome. Eating highly packaged processed foods kills off our gut microbiome, creates gut hyperpermeability, increases inflammation, ruins blood sugar and insulin stability, and wreaks havoc on our bodies and our brains. If we think we can help heal people's brains and teach them new ways of building their life in recovery, when their brains are inflamed and their blood sugar and their insulin is totally out of whack and they have no gut microbiome to make neurotransmitters, 90% of our neurotransmitters are made by metabolic byproduct of the gut. If we don't have a healthy gut, we ain't making no neurotransmitters, and I can prescribe all the Prozac in the world and no one is ever going to feel better. That's the truth. And highly packaged processed foods destroy the health of the gut microbiome. But we consume 60% of it. So it sort of sounds like I'm being mean and like judgmental and maybe a little bit irritable and angry. I am not angry at anyone but the food industry. The food industry, in my mind, is just as toxic as big tobacco. They have created, amen. They have created a food sourcing economy that is making us sick. There's no broccoli in the checkout aisle. There's no broccoli at the Ace Hardware. Why did they sell food at Ace Hardware? I have no idea. But there's no broccoli at the hardware store. There's no broccoli at Walgreens. It's soda. Sorry, free fountain drinks. I'm not very happy about that. Soda, coffee drinks, sugar coffee drinks, Airheads, Twizzlers, right? You guys know what I'm talking about. Gardettos, all those things. Highly packaged processed foods are toxic. This is the NOVA food classification. I use this as a handout, so the writing is really small, you can't see it. But the NOVA food classification was developed by a nutrition medical group in South America to talk about what our foods look like. Basically, group 1 is unprocessed foods. So like a tree right off the branch is a group 1 food. And then you kind of go down through the different levels of processed foods until you get to group 4, which is ultra-processed packaged foods, which is all the stuff I'm talking about. We have so much access to ultra-processed foods that it's really hard to think that you have any other option. But I promise you that you do, and a lot of people like to see things in writing. Like listening to me rant and rave about it is probably annoying to a lot of people. But if you want to actually read something that might just start to simmer a little bit, that's not coming from me, but is coming from the New York Times, which I think is a fairly reputable resource. The New York Times recently had an article that talked about the correlation between highly processed foods and brain health. And this is really becoming, I think, more mainstream, but like we need grassroots effort to really grab hold of it, right? So this New York Times article is specifically referencing this article, looking at a cross-sectional examination of food consumption and adverse mental health symptoms. So this is correlation, right? Not causation. This isn't a large randomized control trial, but it does give us some fairly good information that the more people eat highly processed packaged foods, the more they experience mild depression, more mentally unhealthy days, more anxious days, they're less likely to report 0 mentally unhealthy days and 0 anxious days. Like, this is all of us, but it's definitely all of the people that we're taking care of. Why do we continue to feed people in a way that stimulates behavioral health symptomatology that informs substance use and informs return to use? It's absolutely beyond me. I don't understand it at all. So, randomized controlled trial studies, these are 4 of them. I'm not going to go into them. The references are at the end of the deck. These studies look more at causation rather than correlation. So these were randomized controlled trials looking at people who were eating food as usual versus very high nutrient dense diets, Mediterranean diet, DASH diet, and whole food plant-based diets. And all of the people in these studies that ate healthier, nutritious diets had better mood, less anxiety, less depression. In the Geico study, they had better work satisfaction, they liked their colleagues and coworkers better, and they had less job turnover. So that's pretty exciting, right? So these are all more causative studies looking at the importance of nutrition and mental health. One of the things I try to talk to all of my patients about is this hypothalamic pituitary axis. Do you guys all know HPA axis? Does anyone know this? So the hypothalamic pituitary axis is intimately involved with the cycle of addiction for a lot of different reasons, but just to simplify it, you know, when people are using substances, no matter kind of what they're using them for, by the end of the process, by the time they have moderate to severe use disorder, they're no longer, you're not using substances to feel better, you're just using them not to feel so horrible, right? So that's the negative cycle of addiction, the negative piece of the cycle of addiction. And that is mediated very clearly and specifically by the hypothalamic pituitary axis. The hypothalamus releases a hormone that then causes the pituitary to release a hormone that then causes the adrenal glands to release cortisol. And cortisol is our primary fight or flight hormone. Norepinephrine and epinephrine are small protein neurotransmitters that get released at the same time. This is what makes us, be able to run away from the bear, right? This is what is activated in us when we feel anxious or panicked. And this is what people feel when they are experiencing withdrawal. And this really drives the return to use in the immediate withdrawal period and for months to years after in post-acute withdrawal and even ongoing in recovery. This intense desire to calm down the fight or flight system. And so a lot of my work that I do and the acupuncture that you guys are getting is all designed to help recalibrate and reorient the HPA axis And nutrition is incredibly important for that process. And so when I talk to patients about food, sugar, salt, fat, highly packaged processed foods, I try to explain to them this process. It's the same thing whether you smoke a cigarette, drink alcohol, use a stimulant, use an opioid. You calm down the fight or flight system. That's why we feel better. And then when the substance goes away, the system comes back online, but it's like much more exaggerated. The same thing happens with food. The same thing happens with sugar, fat, salt, anything highly packaged processed. That's why we keep going back to it. That's why there's no broccoli in treatment or in meetings or anything else, because broccoli never made anyone feel better right in the moment. So I try to explain this to people, and there's actually very good evidence now that this is true. It's controversial in the nutritional field, whether this is really cross-addiction, food disorder, eating disorders, disordered eating, whatever it is. David Wiss, myself, there's many others of us who feel that those are semantics. Like we're just like, grasping at straws to explain this. The reality is that food is addictive, just like every other substance. And if we don't start thinking about this for our patients in recovery, we're doing them a huge disservice, because they just move to sugar or salt or fat, and then they develop type 2 diabetes, cardiovascular disease, hypertension, cancers of lifestyle. I've been taking care of a guy for 6 years. Incredible recovery story. His life was completely demolished when he found me. He was living in his mom's basement, separated from his wife, two very young kids. And I guess we were in St. George, so it was like a month ago. We're doing our acupuncture training in St. George, and I see this name come across my phone, the friend of this patient of mine, and she never calls me, she only texts me. And I was like, something's not right, I better pick up the phone. So I picked up the phone, and she was on the phone, and my patient's wife were on the phone, and he died in his hotel room at a golf tournament of a large myocardial infarction, widowmaker. And he'd been in beautiful recovery for 6 years. He had just started a new business with his wife. His son had just started playing football. His daughter had just gotten her driver's license. And I was so grateful because I had seen him on Thursday, and I hadn't seen him for a couple months, but I was like, hey, come in. It's my last week in my old office. I want you to just come in. Let's do a check-in. And I got to see him, and he was like, Amy, I feel better than I've ever felt. He'd lost some weight. He was starting to work more on his nutrition. He was going to Pilates 3 to 4 times a week. He wasn't in pain anymore. He had a lot of chronic pain, which is why he started using opioids. He was on buprenorphine stable for 6 years. He was like, I feel better than I felt in years. And Thursday, Friday, Saturday, 2 days later, he was dead. His friend did CPR, and then they coded him in the hotel room for an hour. So this is important. This is why it's important. People with substances die more of chronic disease, not directly related to their substance use, than they die of anything else. And they die faster, and they go to the hospital more than people that don't use substances. So this is why it's important. Sorry, everybody gets mad at me when I put this slide up. So now I've given you all the bad news about all this. So what can we do to really start to help people? Well, in my line of work, I do very intensive treatment, very intensive lifestyle protocols. I did a lot of work at Odyssey House with nutrition. It's an intensive process, but there are things that we can do every day to help ourselves and to help our patients. Because if we want our patients to start getting better, we have to be good role models, right? So getting really clear about your own ideas about nutrition and wellness, I think, is the first step. Something I talk to people about straight out of the gate, I try to be positive in my approach. I try not to say, don't eat that, don't eat that, don't eat that, don't eat that. I try to get people to eat more healthy things and move more healthy foods into their diet to sort of crowd out the more naughty foods. But the one thing that is just a non-starter for me is sugary drinks. We consume more of our calories and more of our sugar in this country in the form of sugary drinks than anything else. Look at how much sugar we should be getting. No more than 6 teaspoons for women, no more than 9 for men. I mean, you get a sugary drink and it's got 30 to 60 grams of sugar in it, and then you add in all of the caffeine from a Monster drink. This is just eating away at the integrity of your gut health, first and foremost. It's destroying the gut microbiome, and it's breaking down the healthy layer in the gut that separates the inside from the outside, which again creates a lot of inflammation. And if you have inflammation in your body, you have inflammation in your brain. And inflammation in the brain drives anxiety, it drives depression, it drives obsessive thoughts, it drives craving. And the data supports this. So the sugary drink situation is just sort of a non-starter for me. It's the one thing I really try to ask patients to consider. And what do I tell them to replace it with? There's so many great things. Water, sparkling waters, as long as there's no artificial sugar in them. Artificial flavoring is also incredibly toxic to the gut microbiome, and it stimulates insulin release. So artificial sweeteners, unfortunately, are not the best answer either, but still or sparkling waters are cheaper than soda, so people are actually saving money. And they fill up the stomach with all the bubbles. The carbonation actually stimulates the nerves in the stomach to make the stomach feel like it's full. So when people say, well, I'm just like hungry all the time, I'm like, when you're feeling hungry, like if you've just had breakfast or lunch or dinner and you're feeling hungry or like bored, get some sparkling water and put a lime or a lemon in it. The combination of the citrus and the carbonation sort of calms down that sort of craving or that hungry feeling and sort of quiets down the stomach and the brain. Green tea is an amazing antioxidant, and it's really powerful for the gut microbiome. The bugs in the gut love green tea, and it reduces inflammation, which is great. An antioxidant reduces inflammation. So green tea is a great thing to give people. Sometimes green tea can make people feel nauseated, so they have green tea plus ginger formulations, which can be really nice for people, especially if they're experiencing withdrawal or craving and they have some nausea. People really like green tea with ginger. Coffee is an antioxidant, but not when it has the, yummy hazelnut vanilla in it. But I admit I totally put my coffee this morning because I took myself off of it like 3 years ago, and I was like, oh, there's flavored creamer here, I'm gonna have some of that. So I had some of that today, but coffee is a great antioxidant and a great thing to give people as long as they're not getting it too soon to bedtime. I usually cut people off caffeine around noon so they can sleep. Do you have a question?
Yeah, what about just milk with no sugar, just normal, like organic milk? Does that take away from the effect of coffee? I saw no milk on there.
I'm not here to get into a controversy with anyone, but I take all of my patients off dairy because I encourage them to reduce their dairy use because dairy is really hard on the gut. It creates a lot of inflammation and it kills off the microbiome. But yes, just having some plain half and half or some plain whole milk, a little bit of that with coffee I think is great. Agave syrup is a nice sort of natural sweetener, and you only have to use a tiny, tiny bit of it because it's so potent. It's a nice little sweetener, so I'll say maybe use a little bit of milk and a little bit of agave syrup. I try to get people onto plant milks, to be honest with you. Plant milks are not without complication either, because they all have additives and stuff in them. But in my opinion, they're a lot better for the gut and reduce inflammation as opposed to dairy products. Yeah?
So unofficially, I have a lot of people ask me how I lost weight.
How much did you lose?
250 pounds.
Whoa! Wow! Good for you!
So just because I've lost that much weight, people are always asking me how I lost it. And so, and I did it just by doing lots of teeny things. So one of them was switching to water. But I found there's a lot more now, but because I don't really like coffee, I drink milk flavored coffee.
You drink what?
I drink more like milk with coffee flavoring in it because I don't want coffee.
Oh, okay. Milk with flavored
Yeah.
coffee. Milk flavored coffee.
There's a brown chocolate that's the cocoa bean out there now that isn't, it's no sugar, it's just, and you can make it like coffee. That is amazing.
Okay, what's the brand?
There's more than one brand out, but the one that was the first is called Cocoa Bears. It sounds like the cocoa bean, cocoa bean.
Okay.
It's actually made here in Utah.
Oh, cool. Okay, well, ask the lady in the plaid shirt for tips and tricks and the name of the coffee flavored milk. Thank you for that tip. I appreciate that. Yeah?
Sorry, just one more thing. So like stevia plant, is that kind of like a sweetener too, or like a sugar?
Yeah, so the question was about stevia. So I personally think stevia is probably one of the best ones. It's one of the more natural ones, but there's a lot of artificial stevia, which I don't really understand. So you just have to be really careful that you get the 100% stevia plant concentrate or whatever it is. Resveratrol, do you guys know resveratrol? That was a big one for a while because it was one of the natural sweeteners that was shown not to raise insulin, but apparently something has just come out about resveratrol hurting the brain, and I don't really know what that's all about, but I don't recommend any artificial sweeteners. If people really want sweet, I try to get them to use a tiny little bit of agave syrup just because it's natural, but I think stevia is fine. Okay, so the first thing that you can do that's really low barrier for yourself and for your clients or patients, maybe think about replacing sugary drinks with some of these things that we just talked about. And then the second thing that I try to talk to people about early in their recovery process as I'm starting to bring in more of these ideas about nutrition and movement and all that, is trying to add fiber. And why is fiber important? Fiber is important because it's really the only thing that the gut microbiome eats that it actually likes, that it doesn't do something naughty with. So bugs eat the food, digest the food that we bring into our bodies, and they make all sorts of metabolic byproducts that support our health. So they make our neurotransmitters. They're involved in making neurotransmitters, dopamine, serotonin. And the other thing that they do is they make something called short-chain fatty acids. And short-chain fatty acids are incredibly important for our brain. They support the health not only of the neurons, but of these little cells called microglia that live in between the neurons in the brain. And I basically call the microglia like the junk cleaners. They clean up all the junk in the brain, and they help support the health of the neuron. And short-chain fatty acids help nourish the microglia and help support their activity. And short-chain fatty acids can only be made by bacteria in the gut by eating fiber. We don't eat any fiber in this country, like none, like barely any. I think people should get 50 grams of fiber, but that's really, really hard. I try to get people to shoot for 25 to 30. And how do we do that? What's a low barrier way of doing that? This is the healthy plate. This has sort of replaced the food pyramid. The food pyramid, I would just kind of push that to the side and maybe start thinking about the healthy plate. Half of whatever we eat should include a fruit or a vegetable, some source of fiber. Fruits, vegetables, beans, legumes. What are legumes? Soybeans, why am I blanking? Lentils. Thank you. Lentils, soybeans, peas, those are all examples of legumes. They're very, very high in protein, and they're very, very high in fiber. And then we have all of our grains, like oatmeals and barleys and quinoa and farro and all of those things. But those are really beyond a lot of what we're seeing in patients in early recovery. Like if somebody's just trying to get their life together, we can't really say, oh, why don't you go out and buy some quinoa and farro and make sweet potato Buddha bowls and then you'll be better. I realize that that's not always what we can do in the beginning, but we should at least be thinking about talking to our patients about some of these simple, low barrier ways of increasing fiber. Have a fruit or a vegetable 2 to 3 times a day. You can buy bags of apples, bags of oranges, bags of carrots, bags of celery at Walmart or Costco or Sam's or Winco or any of those places for way less than it costs to go to the drive-thru 2 or 3 times a day. I promise you, I've done the research. I know it's true. Let's try to think about getting patients to have more fiber. Half of everything we eat should have a fruit, vegetable, bean, legume, nuts, seeds, healthy sources of fiber. And then these are just some additional, I don't know if you guys are going to have access to the slides, but these are just some of the things I use for my patients. Nutritional supplements, I only have 5 minutes. Magnesium, so there are 4 things that I talk to patients about as far as supplementation. Magnesium, melatonin, N-acetylcysteine, and fish oil. Magnesium helps with sleep. Magnesium helps calm anxiety. Magnesium threonate and magnesium glycinate are the ones that actually get to the brain. Different forms of magnesium just stay in the gut and help us poop. Like they're great laxatives for people on buprenorphine and things like that, but not very good for going to sleep. So magnesium, glycinate, or threonate 30 minutes before bedtime can really help with sleep. I almost always have people start melatonin. I'll say a couple of things about melatonin. More is not better, especially for our patient population that's heavily traumatized and heavily stressed. Melatonin at high doses can backfire and give people terrible nightmares and they aren't able to sleep. I try to get people to start with a 1 milligram capsule, not a gummy, a good 1 milligram capsule. Melatonin has to be taken at least 2 hours before bedtime or it doesn't work. Melatonin does not put us to sleep. It helps cue the brain that it's going to be time to go to sleep. At all of the treatment centers I've worked at, and I've worked at I think 5, everybody gets melatonin at 9 p.m., at the 9 p.m. med pass. It does not work at the 9 p.m. med pass. It works when you give it at dinner time. So I have people start with 1 milligram and gradually titrate up every 1 to 2 days. Most people, especially if they're using magnesium with it and maybe a sleeping medicine like trazodone or something like that, especially in the early period, start to sleep pretty well. Melatonin's awesome too because it helps regulate cortisol and it helps decrease inflammation. So I love melatonin. Vitamin D, I won't get into this study. There's a lot of controversy about vitamin D. How high should my vitamin D be? How much should I take? I test thousands of people's vitamin D and no one has a good vitamin D that I've ever tested unless they're on a supplement. Vitamin D should be in the higher range of the normal. So I like between 80 and 100. And I supplement using a capsule that people take once per week that's the cheapest thing on the market. It's like 40 cents a capsule. And I get everybody up into a pretty nice range. There's a lot of data about vitamin D in gut health and brain health. N-acetylcysteine is like my favorite over-the-counter supplement. I have like 2 minutes, so I'm going to finish with this. N-acetylcysteine is a powerful antioxidant. We use it in Tylenol overdose to reduce oxidative stress in the liver when people overdose on Tylenol. The evidence for N-acetylcysteine is, I would say, evidence-informed, not evidence-based. There are not large randomized controlled trials for this, but there's good evidence that it reduces craving for people using methamphetamines who are abstinent. It doesn't help people stop using methamphetamine, but it reduces craving. I had a veteran who was on the heart transplant list. He had methamphetamine-induced cardiomyopathy and was on the heart transplant list. I had to beg, steal, or borrow from them to approve him to get 2,400 milligrams a day of N-acetylcysteine, but after about 2 weeks, we finally got him on it. I saw him 6 weeks later. I don't care if it was placebo or not, but he was like, I don't have any stimulant cravings, and I stopped smoking. I've been trying to stop smoking for 10 years. I have no cravings for cigarettes, and I have no cravings for meth. I really don't care why it's working, but it worked. It works really, really well. And the other thing it does is it helps sort of calm the brain down by being a good antioxidant. It has fairly good evidence for anxiety and obsessive compulsive disorder and for picking. So like if I have people who are using stimulants or early in recovery from stimulants and they have a lot of picking tendencies, this can be really helpful. 2,400 milligrams a day. The brand I use is Now, N-O-W. And you can buy it online at Amazon, and it comes in capsules. And the doses are 2,400 to 3,600 milligrams per day. It can cause some GI upset, so I have people titrate up slowly. And I think that's it. Any questions? Oh, I forgot to mention fish oil. I put everyone on fish oil. It's a very, very powerful antioxidant. 2 grams per day. I love fish oil. Okay. And oh yeah, and we gotta take your needles out. So don't get up and like go to the bathroom and go get food. Let us come around and take your needles out. Question?
Yeah, can you talk about food access and food justice? Because that's a piece that we hear a lot when people go home and when they're back in their communities. I mean, we know, most people I think know and understand the importance of fruits and vegetables, but the idea of being able to get them and what's readily available in your community is a barrier, right? Like that's.
Yeah, and when I do my longer talk on this, I talk about food insecurity and screening for food insecurity and meeting people where they are. You know, like, I don't have a person who's just entered recovery and lives in a food desert. I don't prescribe them quinoa, you know what I mean? Like, I try to be very intentional about screening people for food insecurity and really helping them to understand what the resources are. And, you know, this is a community problem. You know, it just because it's important doesn't mean people can have access to it. But just because access is difficult doesn't mean we should say, well, there's no access, so we're just not going to talk about it. This is a process of working with local food banks to not just, you know, give out the garbage that they would throw out to the animals, but working with food banks, working with local schools that are providing foods. This is a big conversation, much bigger than this. But yes, you have to meet people where they are and give people the resources and reduce this concept that in order to eat even a little bit more nutritious food, that you have to, like, you know, sell your car or something. Like, it's just not true. I did a lifestyle program at Odyssey House, and 2 days a week, they had plant-based meal. And the chef was like, oh my God, this is gonna cost $1 million. I can't believe they're letting you do this, because I had to, you know, Adam Cohen let me do it. And, oh, this is so weird. The plant-based meal is less expensive than the meal as usual. Like, it is the truth that we can feed our communities better food for less money. Megan.
To add on to that, and this is political, so sorry, but be aware of who you're voting for and what they have done in the past, because there's money that can go towards food and feeding kids and feeding families and funding those
Food is so political.
but something to think about.
Think about looking at your politicians and your
City, county,
possible politicians in your city, county, region. Vote for someone who might have an interest in not feeding big food and big pharma and instead feeding our communities healthy food. Yes?
I mean, to be quite frank, I have been doing insecure while I've been losing the weight. I have been eating healthy, but I went on SNAP. There are very good programs that that SNAP has been working with the farmers market.
Yes.
You have to look for these programs. So these organizations need to help their people with knowing what the programs are. The food bank has been opening up new resources across the state for, we call food boxes within my family, I'm not sure what all the words are. So that there aren't as many people that are food insecure. But you have to know where they are.
I think you should make this your full-time job. I think you should be our representative in the state for educating people about healthy food resources. It's so true. I mean, that's why I am very happy when I'm asked to present about nutrition at conferences, because I hope that it gets people's minds going so that on an organizational level, people can start thinking about this to help people, families, communities start accessing and getting better access to resources for healthy nutrition. So thank you for saying that, because that's really inspirational that you've experienced food insecurity, yet you've worked to find ways to nourish your body in a healthy way. And I think that is very inspirational, and it makes me really happy to hear that. And I think you should think about doing some work in that space, because it's really important. Yes.
So is there a difference between, like when you're buying fruits and vegetables, do you want to buy organic?
Yeah, so the question was about organic. You know what? I try to get people healthy foods, whatever they can access. There's something called, it used to be called the Dirty Dozen, but now it's called the Clean 15. It's the environmental working group. That's, they have a list of the things that have the most toxins and the most pesticides and things like that, like strawberries are really naughty. Things with the skin, usually, no, strawberries are not naughty, don't eat them, but they can have lots of pesticides. So you know what, buy frozen organic strawberries. They're cheap, they're accessible, they're super yummy, but things with the skin seem to have less pesticide. But I just tell people, who cares about organic? Don't let organic be your barrier to eating more protein, more fiber, more plant protein and more fiber. Who cares? We care, but yeah. Anyway, thank you.
Thank you.